Welcome to Tidbits of Dissension, a commentary on world-renowned vaccine advocates Paul Offit and Vincent Racaniello as they attempt to discredit the current Secretary of Health and Human Services and NIH Director over the outbreak of measles in the United States. I am your host, Steve Heron. I considered it necessary at this time to make a very public yet considerate response to Drs. Paul Offit and Vincent Racaniello's verbal derision of Secretary of Health and Human Services, Robert F. Kennedy, Jr., and Dr. J. Battacharya, the current NIH Director, which these men have publicized on a YouTube video series, Beyond the Noise. I acknowledge Dr. Offit as a world-renowned expert, advocate, and educator of vaccinology, and one of three recognized for the development of the world's first rotavirus vaccines. I took advantage of as many opportunities as I could to listen to Dr. Offit lecture in person while working at the Children's Hospital of Philadelphia over the course of my 26-year employment there. I worked down the hallway from him and spoke casually on several occasions. He is a generally amiable person. Several years ago, I scheduled a 1-hour appointment with Dr. Offit to discuss my concerns about the potential deleterious influence of vaccines on organ transplant rejection. My aim at the time was to gather more information after a discovery I made that showed evidence of molecular mimicry between a human protein involved in organ transplant rejection and an influenza protein found in the vaccine formulary. I was investigating how a patient awaiting an organ transplant made antibodies to the human protein immediately after receiving the influenza vaccine, what scientists might consider a memory response of the immune system. After entering Dr. Offit's office, he unapologetically informed me that I only had 15 minutes of his time, and then sent me off with the admonition to come back when I had more data. Who am I to question an expert in vaccines? I have a master's degree in clinical immunology. My background is in organ transplant compatibility and disease association testing. I helped to build that laboratory at the Children's Hospital of Philadelphia and later spent time as a clinical laboratory inspector in both the United States and Canada. I spent 35 years in this field, wrote scientific abstracts, and won an award for my work. This month, I published an article in the journal Transplant Immunology, which contradicts current theory in the field, demonstrating evidence that organ transplants are unlikely rejected due to an immune response targeting a mismatched donor organ, but are more likely due to collateral damage resulting from the immune response to viral superinfection and metabolic stress. Superinfection, or infection of a single cell by more than one virus, may include viral components that have been acquired through vaccination, or the adjuvants used to stimulate the immune response. What I did not expect was to discover mistakes in the scientific literature that had been made over the course of the past 70 years, after which I discovered a biological mechanism through which organ transplant rejection and autoimmune disease more likely takes place. While I may not be a vaccine specialist still needs to grapple with the historical errors in immunology that I have found. I'm ready now, Dr. Offit, to provide you with evidence at a molecular level that is consistent with metabolic stress, that vaccines may influence or even cause disease. I am not so sure you will be able to easily dismiss this, despite our employer being a little too eager to dismiss me before I could provide them with this evidence. Most doctors, Drs. Offit and Racaniello included, rely on evidence-based medicine. The algorithm I devised, after 10 years of observing, documenting, and memorizing reproducible patterns, provides evidence that contradicts mainstream scientific theory. Are Drs. Offit and Racaniello willing to reevaluate this evidence and re-explore the science? According to them, the ability of vaccines to cause disease has been debunked. I can assure you neither of these gentlemen can guarantee this. The science has been misrepresented by these doctors and the national media as conspiracy theory, already having been debunked. In reality, there is a legitimate scientific foundation for vaccine components having the potential to initiate or play a causal role in disease. Convincing you otherwise, whether from the perspective of ignorance or intentionality, is overtly irresponsible and crosses the line of deception. While both doctors, Offit and Racaniello, assert the benefits of vaccination to alleviate death from viral infection and consequential chronic diseases, the latter being the focus of Secretary Kennedy, let me be very clear. There has never been any study or research published that unequivocally provides evidence that vaccines cannot induce chronic disease, particularly in the context of viral superinfection and metabolic stress. Zero studies. Viral superinfection, defined as infection of a single cell with two different viruses, which may occur as a result of exposure to vaccine components, may cause chronic disease, whether one is vaccinated or not. It is time to reevaluate the science in light of new information. Studying two viruses infecting a single cell simultaneously is no easy task, which is why it has not been done yet. It is nearly common sense to consider that the immune system may get confused when attempting to sort out parts from distinct viruses, which are all mixed together and cannot be sorted out. Medical doctors and academic researchers are fully aware of how frequently co-infection occurs among patients. Neither Drs. Offit nor Racaniello can be so naive as to claim they have not observed such co-infection patterns among their practices and patients. Drs. Offit and Racaniello are inadvertently placing themselves amid a group of scientists who would attempt to discredit and silence opposing or dissenting voices without due process. Dr. Offit's actions closely follow the footsteps of another doctor, recently crying crisis on media outlets and calling out anyone who contradicts the benefits of vaccines as evil. Are either of these phrases scientific, or do they sound more like a manipulative effort to scare everyone into compliance, sometimes at the expense of their career? A crisis implies acceleration of death rates due to disease, such as we witnessed during the early months of COVID-19. Dr. Offit has cited that prior to 2003, the number of annual deaths attributed to measles in the United States was 4 to 500, approximately 1 out of 16,000 infected individuals. While neither of us relish statistics on how many individuals are dying, the statistics at this point are not approaching the acceleration rate to be considered crisis. This is another example of fear-mongering, which is now being employed to demonize and discredit those who were hired with the task of determining whether there is any basis for vaccines to cause disease. Dr. Offit has criticized Mr. Kennedy's use of statistics, pulling them out of the air. But if Mr. Kennedy's observations have any veracity, and I believe that current technology is capable to demonstrate this, then the skyrocketing number of chronic diseases that have occurred since the advent of government vaccine policies might dwarf Dr. Offit's estimation of a crisis. If indeed Dr. Offit has misunderstood the mechanism that causes these deaths, because these deaths may be attributed to reactivation of multiple viruses that are capable of hiding from the immune system, then the number of individuals suffering with chronic diseases, many of which can be attributed to vaccination, may be over 100-fold higher than the number of deaths attributed to a single virus infection. Doing the math and following the science requires investment that academia and our government have not been willing to investigate as of now. Doctors still take an oath to do no harm, don't they? Or has that been removed from training as well? Dr. Offit has told us that 17 studies have already ruled out vaccines causing autism. Yet he admits that autism occurs whether you are vaccinated or not. The reality of the situation is that no study has been designed to detect whether superinfection may play a role in causing disease, nor has any study exempted vaccines from providing the necessary viral components and adjuvant stimulants to initiate or cause those diseases, because no study design has ever included the appropriate variables to rule out this possibility. Meanwhile, data can be obtained from NIH showing the incidence of autism at a baseline before government policy for childhood vaccination was implemented. The incidence of autism skyrocketed following government implementation of vaccine policy. That is a statistic too, one that is conveniently ignored. But Dr. Offit insists there is no correlation between autism and vaccination. According to an analysis I did, by superimposing onto a well-established disease association the same two viruses that may cause organ transplant rejection, one can discern immune binding sites which may also cause autoimmunity, autism being characterized as such a disease. By following the science and studying such variables, including the broader scope of metabolic stress and individual genetics, new data may result in conclusions that contradict Dr. Offit and Racaniello's assertions. Such data has not been published yet. If you would like to learn more and investigate the evidence yourself, follow me on the LinkedIn series entitled Tidbits of Transplant Rejection. Eventually, I'll discuss the application to autoimmune diseases as well. Hopefully, we can encourage Drs. Offit and Racaniello and others to be a little more eager to invest in research which rules this out, or provide funding and support necessary to combat these previously unrecognized anomalies. I'm Stephen Heron. Thank you for your time and attention.